Good morning, Rural Water. How's everyone today? All right, welcome to the last day of the WaterPro conference. Thank all of you for the discussions and just participating in the sessions. I've really benefited greatly from all the conversations that I've had. I appreciate it. I hope you have too. It's my pleasure this morning to introduce our presenter, Dr. Peter Grevatt, who is the Director of the Office of Groundwater and Drinking Water with the Environmental Protection Agency. And the Office of Groundwater and Drinking Water oversees national primary drinking water standards, which I know you all are very familiar with, regulates the state programs through state primacy agencies, oversees the underground injection control program, and also source water protection programs. Probably some other things I missed, Peter. So he's a very busy person with a lot of responsibilities. I know that you heard the opening session, President Hilton talk about our relationship with EPA and specifically with Dr. Grevatt. And I know he was sincere in that. And I've just appreciated the open conversations that we've had with Peter and the dialogue and his willingness to listen. And I think you'll find today that he's willing to listen to you and he has some important messages to convey. So please help me welcome Dr. Peter Grevatt.
Good morning, everyone. Great to be with you this morning. A very busy person with lots of responsibilities. So you have described everyone in this room, right? I appreciate the work that everyone in this room does. Very busy people with lots of responsibilities, making sure that the folks in your communities are all getting the best quality drinking water they possibly can. It's such important work that you do. So I'm curious just to know who's here. How many of you are live in smaller communities and work with small systems? Probably most everybody here. All right, that's good. And how many of you are here coming from, say, either the Groundwater Protection Council, Underground Injection Control Focus, or IOGCC? Anybody? All right, good. That's helpful. So now I know how I should focus my comments. I want to make sure that I don't want to leave anybody out, and I don't want to make you all bored this morning. So, Matt, thank you so much for that very kind introduction. And thanks, as always, to Sam and to Charles, to the NRWA board for welcoming me here. I always feel very welcome and now at home at NRWA events, and I very much appreciate that. And I think we do have a great partnership with NRWA. I've certainly enjoyed spending the time with you and learning everything I can about your perspectives about the issues that we're working on. So given that over 92% of the drinking water systems that I'm responsible for developing regulations for have less than 10,000 people that they serve, that tells me I should be spending a lot of my time with you folks, right? The regulations hit more of you than anybody else in terms of systems. And so it's a great opportunity to be here. So some things that Matt didn't say about me that's probably good for you to know. I did not grow up in a small town, right? I grew up outside Cleveland, Ohio. I have lived, I was thinking this morning, for the last 32 years in either Arlington, Virginia, Washington, D.C., or New York, New York. And Charles is sitting there. I think that boy better have his head examined. Maybe not the only one. And so that's the smallest town, in fact, that I've ever lived in is Richmond, Indiana. And when I lived in Richmond, Indiana, there were 40,000 people there. So I can't come from personal experience. I can't pretend that I understand what your day-to-day lives are like in your communities, the challenges you face in running your systems. I can't pretend to understand that from personal experience. And that's part of the reason why I think it's so important for me to spend as much time with you as I can to give you the opportunity to teach me what I need to really understand about the way that your world looks. And so it's been great for me to be able to visit with Doug. Where'd Doug Anderton go? It's very with Doug Anderton. You know, we were in Jekyll Island a couple years ago at your annual meeting in Georgia. It was great for me to be with Elmer just this past spring in Kansas. You know, I was talking with Steve Ware about maybe heading down to Arkansas and checking out some small systems there if we can reach them by bicycle. He's going to see what we can do about that. That sounds like a crazy thing to say, but we were talking about bicycling stories last night. And you can be sure that I'm going to want to spend as much time, not just at meetings like this, but also visiting small systems with you as I can. It's a great opportunity for me, and I appreciate the welcome that you all have given me to do that. So when I was growing up in Cleveland, Ohio, I was born in 1961. When I was growing up in Cleveland, Ohio, I was a Cleveland Indians baseball fan. And if you think about the Cleveland Indians, those of you who can remember the Cleveland Indians in the 1960s and the 1970s, that was a tough time to be a Cleveland Indians baseball fan, right? So, and back then, the stadium in Cleveland, it wasn't this Jacobs Field, this fancy little, maybe 35,000 seat stadium. It had Metropolitan Stadium in Cleveland had enough seats for 86,000 people. And it was one of those stadiums that had the big pillars every so far. So I don't know what percentage of those seats were you couldn't actually see the field because you're sitting right behind a pillar. And they really put seats right behind pillars, right? But the bleacher seats when I was in high school for the Cleveland Indians sold for $1 a seat. And they were usually empty. Not many people went out to see the Cleveland Indians. Cleveland Indians had some rough years in the 1960s, 70s, and 80s. The reason why I bring this up is I was thinking about this when I heard about those things that Charles said about me on Monday. He said some very kind words. So the Cleveland Indians were so bad that they would get a new manager maybe every year or every 2 years through that whole period. The way this happened, it was almost always the same. You read in the paper, the manager, he's right like he's going to get out of here soon. And then the owner would always say, giving the manager my vote of confidence. That always meant by the end of the week he was going to be fired. So here I show up on Monday and I hear Charles saying all this stuff. And at first, wow, that feels pretty good. And then you scratch your head and say, uh-oh, am I in trouble? So thank you so much. I genuinely very much appreciate the words that you had, Charles. So I want to talk about, by the way, is Jimmy Gamble here in the room? Jimmy, are you here? All right. So I was talking to Jimmy yesterday, and Jimmy said that he's batting about 50%, batting about 500. He said about half the time I call his name, he's in the room, and about half the time I call his name, he's not. So I thought it would be good just to toss it out. So Jimmy was very helpful to me when I was in Oklahoma. I didn't make your state annual meeting, but I was here for another purpose, and Jimmy took me around to see some small systems around Oklahoma City. And Jimmy, have always appreciated that trip, never forgotten the systems we went to see and everything we learned. So I appreciate your generosity, and great to have you in the room with us today. So I'm going to talk a bit about some of the regulations we have, and I'm going to talk a bit about some of the non-regulatory things we're doing. We have a lot of time. We have an hour, so there'll be plenty of time for questions if people have questions they want to go over. And yesterday, when I was with Jimmy outside at one of the tables, Billy Sims came up. Is Billy in the room? Billy Sims? All right. So I talked to Billy, met Billy yesterday, and I asked him about his thoughts on regulations, because I knew I was going to be here talking to you today. And he said, well, the thing is, we have these technologies that are available to us now that can measure lower and lower amounts of substances in water, right? And he said it seems that the temptation is when you can measure very small amounts of things. There's a temptation, it seems, in regulations to want to go and chase those things you can measure. And he said, I think sometimes that kind of an approach can prevent us from focusing and addressing the things that we know are the really big problems that we need to be on. And need to make sure that we don't find ourselves chasing the small things and then preventing ourselves from having resources and time to work on the big things. And I appreciated that comment very much. And that's something that I'm going to maybe touch on a little bit, talking about various regs. And Charles, several times, has talked to me about trihalomethanes and disinfection byproducts and some of the things that happen, whether it's in a consecutive system, a purchasing system, or in his own system in South Carolina, that, you know, the regulations say very specifically the message that needs to be provided to the public. You know, there's a message that the regulations say that needs to be provided with if you're not meeting the standard for disinfection byproducts, there's a message that message talks about cancer, right? And there's a message that the regulations say that you have to tell the public when you're not meeting nitrates, and that includes the phrase that babies may die. And I very much appreciate from a risk communication perspective that we need to be thinking in our regulations about how we end up communicating information to the public and make sure that we're doing that in a way that's going to be effective and has the desired intent. Regulations are very important. Being in compliance with regulations are very important. They're health-based standards. And at the same time, if we communicate with the public in a way that frightens them so much that they begin to question, not just at the moment that a system might have a violation, but even perhaps for months or years afterward, question whether that water is still safe for them to drink, that I think is a problem that we need to think about together and how we address. So I appreciate, Charles, you raising that issue, and that's one that I know we're going to have a chance to talk about back in Washington. You'll make sure that's the case. I'm going to talk about, as I said, both regulatory issues and non-regulatory issues, and a number of the biggest challenges and the problems that we faced looking nationally across our programs have to do with source water protection in the last couple of years. So, what's the quality of the source of the water that you have available that many of you, or I guess I'm thinking of examples here of some much larger cities, what's the quality of that water they've had available that they had to treat to serve up to their population? So in the last year, we had the opportunity to see in both Charleston, West Virginia, and in Toledo, Ohio, what happens when you tell 300,000 or 500,000 people that their water is not safe to drink. That's a pretty big challenge, and very different issues in Charleston and in Toledo. Charleston was about a leaking tank at a coal washing facility on the Elk River just upstream of the West Virginia American water intake. Toledo was about harmful algal blooms and really a terrible bloom in Lake Erie. If you saw the pictures, I didn't bring them for you today, but if you saw the pictures of the water that they were having to treat, it's really pretty stunning. Those are important issues that we need to continue to work on together. And we're thinking not just about what happens in the distribution plant, but also thinking about what happens, not just what happens in the treatment plant, but also thinking about what happens in the distribution system. So we've been doing some work over the course of the past year on Legionella. And there are a number of communities, especially maybe some larger communities that have a number of dead ends in their pipes that have had increasing problems with Legionella, especially in premise plumbing. We don't see this as an issue with the treatment plants. It's really an issue about distribution systems, in many cases premise plumbing. That's an issue that we're going to be working on over the course of the next year. But one of the things that you'll hear me coming back to again and again this morning is the year 2016, because there's a lot that's going to happen in 2016 from a regulatory standpoint. So keep that in mind. It's not going to be hard for you to remember because you're going to hear me say that year a bunch of times. So first, why don't I talk about the revised total coliform rule, and you all know that the compliance with RTCR begins in April of 2016. and getting ready and helping you all to get ready for RTCR implementation has been a top priority for us. And we've heard from, and I have to say, who's here from New Jersey? Anybody here from New Jersey? All right. So I'm sorry I haven't met you yet. Maybe we can meet after the meeting, because we've been hearing from the state of New Jersey that New Jersey Rural Water has been doing just a tremendous job in helping small systems get ready for RTCR implementation. You know, the state's been very specific in calling you all out and saying how much they appreciate the work that you've done to help small systems get ready. And we want to continue this work with all of you. We know how important NRWA has been in terms of training and helping small systems get ready. It's a big new rule. It's an important rule. We think it's one that offers some really good flexibilities for systems. And some states, of course, are implementing RTCR before April of next year, including in Region 1, Massachusetts and New Hampshire, Delaware in Region 3, and Alabama, Kentucky, and Tennessee in Region 4. In preparation for the implementation of RTCR, we released, just last week, we finished a document that's intended to help systems smaller than 1,000 customers with implementation of RTCR. Hopefully some of you have gotten that by email. If not, we can make sure that gets around, and we are very pleased to have that out. I read through the whole thing, and I thought it speaks fairly plainly about some of the issues that are frankly a little bit complicated, and hopefully you'll find that resource to be very helpful. We also finished a little bit earlier this summer some fact sheets that are accompanying that document. Adrian Harris on my staff here in the second row was instrumental in putting together those fact sheets, and so kind of one-pagers that we think you can borrow from in terms of training materials. Make sure they're getting out to small systems. Feel free to take a piece of that and build it into your own communications in the way that's going to be most helpful. And if you have any questions about that, Adrian is wearing a lovely, should I call that red or orange jacket? Orange jacket in the second row over there, and she'd be glad to help you with RTCR issues. We're also going to be, in just a month or so, completing a transition memo that specifically focuses on transition from TCR to RTCR, and how to handle some of the requirements around CCR or PN, and especially since the RTCR revised health effects language can be a little bit confusing for folks. So we're hoping that transition memo will help folks to work through some of those issues. In terms of the specific topics covered by the fact sheets, it's probably just good to touch on those briefly. That includes requirements for small systems on monthly monitoring, requirements for small systems in quarterly or annual monitoring, requirements for seasonal systems, repeat monitoring requirements for small systems, and the level 1 and 2 assessments and corrective actions. And I know that RTCR is pretty complicated, and so we're hoping that these fact sheets will help you out, and the new guidance will help you out. But if you have questions, please let us know and see how we can assist you with that. We're also updating a consumer confidence report iWriter. And you know, one of the things that happened early on, and Charles and Doug, I think Doug was pretty instrumental in helping us to appreciate how important it was moving to electronic reporting in the CCR, and I know many of you have probably taken advantage of electronic reporting as opposed to printing all those reports, or some of you maybe put them in the newspaper or posted them publicly. But for a number of systems, there was a pretty significant expense associated with that. In conjunction with helping people to put together and meet the requirements for the Consumer Confidence Report, we have the iWriter, which is an online tool to help public systems to comply with the CCR requirements. We just updated this tool to meet the new security requirements from the agency, and also we're updating it to reflect the new RTCR requirements. So hopefully that'll be helpful for you. So I had a chance to meet with a number of board members over breakfast this morning. We had a lovely breakfast, and And Kent from Texas, who's in the front row, and it's great to see you again, Kent. He asked me the question, so where do you think the lead and copper rule is going? Which is a pretty complicated question. How many of you love the lead and copper rule? I'm not seeing a single hand. So we know it's one of the most complicated rules to implement, and many folks have found effective ways to do that, and Charles has talked about some of his success in his system, and I know many others of you have as well. But it is tough when you're working with, with community residents about how to collect samples, when to collect them, how long to flush and not flush the system, and first draw, and all those kind of complicated issues, getting the bottles back. So we're in the process of developing long-term revisions to the lead and copper rule. Some of you may be aware of this, and John Sasser has been very helpful to us in this process. We've had a work group under an advisory committee that reports to the agency, the National Drinking Water Advisory Council. We've had a work group trying to look at the various aspects of this rule and figure out what makes the most sense. How can we make it more easily implementable and also maintain the public health protections? And certainly one of the big issues that they've been looking at is the sampling protocols and how they're implemented in the rule. They've also been looking at lead service lines and what's the right answer on a lead service line. There are 10 million, we estimate 10 million lead service lines in the US today, spread especially across older communities in the US, but we know in many different places still have many lead service lines. And one of the things that I mentioned to Kent when he asked me this question is thinking about the intersection of the Reduction of Lead in Drinking Water Act. That's the act that redefined the allowable concentration of lead in the, I'm sorry to be so, this is a little dweeby, but the maximum allowable concentration of lead in the wetted component of fixtures and fittings and pipes and solder. So it used to be 8%, went down to 0.25%. How many of you were challenged when that change came from Congress? How many of you were challenged when that change came from Congress in terms of replacement parts that you had on hand that no longer were compliant with the new definition? There must have been many of you, because we heard from a lot of folks. So the reason I bring that up is part of what this work group on the lead and copper rule has thought about is, so the Reduction of Lead in Drinking Water Act says that water can't pass through, you can't buy a new fixture or fitting that has more than 2.25% lead in the wetted component. That's the part that the water's touching, right? So think a faucet, can't have more than 0.25%. But that water can pass through 50 or 60 feet of pure lead pipe before it gets to that faucet, right? So our challenge is in thinking about the lead and copper rule is how do we reconcile that, and what's the best solution to make sense of this from a public health protection standpoint, right? Because we can guess that leaded pipe, if corrosion control is not in place and is not optimized, that leaded pipe is going to contribute a heck of a lot more lead to that water than that little faucet is, right? So we're thinking about these things together and trying to see how we make the most sense of it. One of the things the work group has talked about, they're going to be briefing our full advisory council this fall. And the advisory council provides recommendations to the administrator about how, an EPA, about how we address the rule. So that the group, including John, who've been so dedicated over the last year and a half in working through these issues, one of the things that they certainly have talked about is, one of the best solutions is to get lead service lines out of the ground. Okay, that's probably not news to a lot of people in this room that might be one of the best solutions, but there's some challenges with getting lead service lines out of the ground, right? One of the challenges is probably how much does it cost to pull 10 or 11 million lead service lines out of the ground. Another challenge is what part of that lead service line do you, as a utility manager, control? Well, I bet you control the part that goes from the main to the property line, right? And then there's another part that goes from the property line to the house. One of the things that happened historically in implementation of lead and copper rule is people who were complying with the rule, doing their best to follow what the lead and copper rule says, was, all right, well, if I can't remove the portion of the pipe that runs from the curb to someone's house, at least I can get out the portion that I control, right? I'll do a partial lead service line replacement. Well, what we discovered when people do partial lead service line replacements is sometimes it makes the problem worse. And it shouldn't, I mean, it's not that much of a, it's not rocket science, right? It's not that big of a surprise because you're cutting, right? You're cutting a pipe, maybe there are particles that are released, you might be opening up some exposure of lead to the water again. And so folks who were doing their best to do the right thing realized that there was a problem that was occurring. So one of the things that you can be sure of in the new lead and copper rule is we are going to steer utilities away from partial line replacements. We do not think that's going to be a sensible approach. But it still leaves the challenge of where does the money come from and what are the legal issues that come up. Charles has told me he can't force a resident to remove the portion of the pipe that they own. It's their property. He has state laws, local laws that prevent him from doing that. So these are pretty challenging issues that we have to work through. You can be certain that corrosion control and effective corrosion control is going to continue to be a very important piece of what we do under the lead and copper rule. We want to prevent exposure with corrosion control. We're putting a film, a barrier between the lead pipe and that water to protect the public. And we've shown that that can be done effectively. But we got to think about the whole picture together. So it's a pretty challenging rule. Certainly not one of the easiest ones that we deal with. And unfortunately, I mean, as it turns out, it's not at the treatment plant that the lead is being introduced to the system, right? So measuring it would be so much easier for all of you, I know, if we could take samples at the treatment plant. But the real issue, right, is what happens really right near the end of the distribution system, right before you get to a house. And that lead service line is really one of the biggest issues we're concerned about. So I'm hoping we can find a way to make it easier for you and also make sure that we're protecting the public and giving them the assurances that they need and they deserve. But that's a tricky rule to work through. So in terms of the process in this, we're going to get our advisory council will get briefed this fall from the work group on this with their recommendations. They will provide recommendations to EPA, and we'll be working through this issue in 2016. We may get to a proposal before the end of 2016. That would be the goal if we can. Okay, so the next thing I want to talk about is is CCL4. Okay, so the CCL, the list of contaminants that may be appropriate for regulation in the future. That's the CCL, the contaminant candidate list. Okay, and we have to do that on a recurring basis. The fourth one, we published a draft in February. It had a fairly long list of chemicals. It went out for public comment, and I would say number of comments we got back on that is, does the list really need to be that long? Okay, so we're thinking through how to respond to public comments on this. And what we did is we carried over essentially all the chemicals that were on the previous list, the third contaminant candidate list, to the fourth, and we asked the public if there's anything else that ought to be on there. And the public nominated a number of contaminants, and we added just 2 in the proposal from the public nominations to the list we had before. But the question still remains, what's the appropriate length of a list like CCL4, and what happens when EPA presents a list of chemicals and says these are potential candidates for regulation? What does that mean for you all in a system? What does that mean maybe for companies who manufactured some of those chemicals? Those are all things that we're thinking through. So we're reviewing public comments. We're going to be getting a report from our Science Advisory Board, the SAB. They just met on CCL4, hopefully very soon. And we plan to publish the final new contaminant candidate list in 2016. Okay, so another rule that's going to have a big piece coming through. So another process that I know many of you have been involved in, working with EPA, is the Unregulated Contaminant Monitoring Rule, UCMR. That's the rule that says we need to go out and sample water systems across the U.S., a subsample of smalls, all big water systems, to determine the occurrence of various chemicals that are of interest, chemicals and substances of interest. There's 30 on the UCMR. Probably the biggest issue on UCMR that I've heard about gets back to the first thing that when I shared what Billy Sims said to me. So we've got technology to measure pretty low levels of chemicals. And in UCMR, we decided to use that technology and report on fairly low levels, even below health-based levels. And I've heard from a number of systems, folks have said, when we have to tell our customers that there is this stuff in their water, and there's no unregulated contaminant, right? There's no standard. We can't tell you whether we're above a standard or below a standard. We can't really say that much about the safety of this stuff, that it can create a communication challenge for all of you. And I don't know how much of that's been a headache for anybody here. Anybody had an experience with UCMR reporting that's been difficult? Just a couple folks. Well, I'm glad it's not, all right, a couple more. I'm glad it hasn't been, this isn't like the question where I said how many people, I asked the question, how many people love the lead and copper rule? If I'd said how many people hate the lead and copper rule, I was afraid to ask that question because I knew what was going to happen. It was going to be, oh, me. So I'm glad this hasn't hit too many of you this way. But the UCMR, it allows us to get a sense of the nationwide occurrence of contaminants that we think are things that are important for us to look at, and for potential regulations in the future. And so the UCMR process is just wrapping up soon. We've done a number of sampling rounds already, and it so will help us to get a better sense of the occurrence of some important chemicals. One of those on that list that was included in UCMR is strontium. And some of you who've been following some of our regulatory activities will remember strontium as the one chemical that EPA in our sorry to use these are all legal terms, but the regulatory determination process is one that EPA uses where we say, all right, we're going to make a decision now about chemicals that we either will plan to develop a regulation for or not plan to develop a regulation for. It typically follows the UCMR process. In our proposed regulatory determination that we issued a number of months back, right around the turn of the year, and it was open for public comment at the beginning of this year, we had 4 preliminary negative determinations that we proposed and 1 preliminary positive. The first time we've ever done a preliminary positive regulatory determination. That was for the compound strontium. Occurs mostly in groundwater, and most small systems are served by groundwater as I understand it. So I know this has been probably a concern for some of you. Where is this going to go? Are we going to get a new regulation? So we're looking at the public comments now. And I know I keep coming back to Charles, probably because I spend among NRWA more time with Charles and Sam than almost anybody else. We're going to make sure that we have a sound science basis for whatever we move forward with. And we're hoping to have that final reg determination done soon. It will probably come at least in fiscal year, certainly come in fiscal year 2016. So that one's going to be coming up soon. Okay. I mentioned UCMR 3, that's the sampling that's happening now. UCMR 4, the 4th unregulated contaminant monitoring rule. We had a stakeholder meeting last summer to start looking at what might we include for sampling in that next rule. We're going to propose the rule later this fall, which will be in fiscal year 2016. And we're going to have a public webinar following the proposal. So this is going to outline a list of 30 chemicals and substances that we think should be monitored in UCMR 4. And some of the contaminants that are being evaluated that I expect you may see in the proposal include cyanotoxins. And A number of you probably are aware of some of the work we've done in cyanotoxins over the course of the last couple of years, primarily related to the Great Lakes, but not limited to there, but looking at the algal blooms and the impact they've had on systems both large and small across the U.S. And appreciate I should have mentioned, I appreciate in terms of Reg Det 3 the comments that NRWA provided on behalf of all of you about concerns about strontium and small system impacts. The next rule, and I hope you're not starting to get bored to tears. I'll stop soon. But the next rule the next process, it's not a rule, the next process that we're working through is called the 6-year review. So the Safe Drinking Water Act says that every 6 years we have to look at drinking water regulations to evaluate them for whether there's any either updated health assessments on chemicals that are available, any new occurrence information, changes in treatment technologies, or other factors that tell us that we should make a change to the rule to ensure we have increased public health protection. So what are some of the contaminants that are included in this 6-year review? Maybe you can let me know if any of these are contaminants that you really care about. So the first would be fluoride is included in this 6-year review. I would say that fluoride is probably the single chemical that is more controversial than any other that we work with in terms of public concern. So it's a very interesting dynamic when you recognize that the Centers for Disease Control recognizes fluoridation of water as one of the top 10 greatest public health accomplishments of the 20th century. And then there are also legitimately concerned citizens who view addition of fluoride to drinking water supplies as poisoning the public. So we're in the middle of that dynamic and recognize and don't discount in any way the concerns that some people have about this issue, but recognize we've got to figure our way through this. So CDC provides recommendations about how much fluoride should be added to water, right, to help prevent cavities. EPA regulates fluoride in terms of the maximum amount that can be in drinking water and finished drinking water. So it's a lot of moving pieces here. But in the 6-year review, fluoride is one of the chemicals we have to look at to determine whether the MCL is right or whether it should be adjusted. The second one is LT2, the long-term 2 Enhanced Surface Water Treatment Rule. That's another rule that we're looking at as a part of the 6-year review. Of course, LT2, the history for LT2 really surrounds Milwaukee and the cryptosporidium outbreak in the 90s, where 400,000 people got sick, right? And about 50 people died there. So we're looking at LT2 as a part of the 6-year review. We're looking, Charles, at the microbial disinfectants and disinfection byproducts rules as part of the 6-year review. Charles says that's a good thing. Well, we'll circle back on that later and see if you still think it's a good thing. That's one of the things that we're looking at. Chlorate and nitrosamines are two compounds that disinfection byproducts that we're also considering as a part of the 6-year review. So there's a lot that's wrapped up in this, and we will be publishing our 6-year review in 2016. So this is not a new rule, but it's signaling rules that we think that we ought to take a look at as a part of reviewing existing rules. I'm going to touch on perchlorate very briefly. That's a compound that probably has not impacted that many of you, but in certain parts of the country, in Nevada and California and Massachusetts, it's been a very significant concern. So EPA decided to do a regulation on perchlorate several years ago. And we have been in the process really of evaluating the science since that decision was made. We went to our Science Advisory Board, as we're required to do when we're developing a new rule under the Safe Drinking Water Act, and the Science Advisory Board said, we don't think that you have a good enough understanding of the toxicity of this compound. We think you need to do more. So we've been working with the Food and Drug Administration over the last couple of years on a modeling effort, which is about to come to fruition. We're going to do a peer review of the model that we have developed in 2016 and give the public a chance to kind of see, it'll be a public meeting, give the public a chance to see the work that we've done, get feedback from the peer reviewers, and help to determine whether we've got this right now. It plays, obviously, the determination of how toxic a compound is has a very important role in terms of whether you're going to, how you're going to write a regulation for that compound. So that's a pretty important piece. In terms of some non-regulatory items I wanted to touch on, because I think there are many, many very important non-regulatory things that we're doing. The first is a flood resilience guide and drought response and recovery guide. You know, we've been thinking about extreme weather events and how we best help small systems and large systems to prepare to be as resilient as possible to floods and drought. And I know these have been big challenges for many of you. How many of you had a major flood that's impacted your system, say in the last, say 3-4 years? I would say fewer than I thought. How many of you have been struggling with drought in your system? Probably more people with drought. Now here's the trick question. How many people have been struggling with both drought and floods at the same time? Right, a bunch of folks, and it's actually become more common that we're seeing that. And Kent, I think, and probably in Texas, right? We heard an awful lot about the crippling Texas drought that you had. And then we got to hear and see pictures of, I think I mentioned the other day, is cars floating down I-45 in Houston, floating down I-45 in Houston, right? And I think it's not the only place. I think here in Oklahoma, one of the recent droughts ended with some flooding across different parts of the state. So we're trying to provide some tools to help both small and large systems to prepare for drought and for flood events and how they become as resilient as possible to those. I mentioned harmful algal blooms in the context of the unregulated contaminant monitoring rule. We issued health advisories and some guidance to systems earlier this year on harmful algal blooms. This is an issue that the Congress has been very, very engaged in, especially those representatives who serve communities around the Great Lakes. All right, so we issued health advisories on cyanotoxins, and it's pretty remarkable. I don't think that I can take credit for this, but it's pretty remarkable the response that the states and water systems have had across the U.S. to this issue just in the course of the last year. If you think about where Toledo was last year, which was really a stunning event to have 500,000 people served, told that their water was not safe to drink. This year, there's an algal bloom that is covering hundreds of miles on the Ohio River right now, bank to bank, hundreds of miles through 4 states in the Ohio River. 33 drinking water utilities are served by the area where there's a dense mat of algae. Not one of them has had to shut down or advise their customers they couldn't provide safe drinking water. Those systems really stepped up. The state of Ohio and neighboring states stepped up to help them manage that problem. There's not been a major event where a water system across the U.S. has said, we can't handle cyanotoxins. I think that's been in large part in response to the states, NRWA, and others in training folks and saying, here's how we tailor the treatment to make sure that this stuff is not breaking through. There's some pretty nasty compounds. They're ones that I mentioned we'll be doing a nationwide sampling effort on in UCMR, I suspect. I mentioned Legionella. I think that's probably not, has anybody here had to deal with a Legionella issue in your community? Yeah, I don't want to say a lot about this because I think it's not something that many of you have had to deal with. But you know, one of the places, Legionella, I mean, this is really a tragic story, Legionella. So Legionella got its name after a Legionnaires' convention in Philadelphia in the 1970s, right, where a whole bunch of people got sick and died. And there was initially this big question about what the heck is going on, this nasty pneumonia-like disease that these people came down with. These are Legionnaires, right? These are people who served our country in the military. And then were sickened at their convention by this nasty bug. We've seen incidents at the Pittsburgh VA hospital, right? Veterans Hospital, where people serve and were being treated there, and had a number of deaths as a result of the Legionella outbreak. We heard from a number of states. Certainly the state of Pennsylvania approached us and said, we're trying to figure out what to do on Legionella. It's a premise plumbing issue. It's not something we regulate under the Safe Drinking Water Act. It's not something we're going to regulate under the Safe Drinking Water Act. But we still think it's an issue that we can provide some assistance to communities on, especially those that have large, we're talking primarily large buildings, hospitals, casinos, hotels. And then we had this really strange and tragic situation in the South Bronx in New York this summer. I don't know how many people heard about this. There were hundreds of cases of Legionella in the South Bronx that was ultimately found to be coming from cooling towers that weren't properly disinfected. So these were people who were being, Legionella being released not inside of buildings but outside of buildings also, and then traveling maybe through an HVAC intake system in a neighboring building and people being exposed. There were a number of deaths there in the South Bronx. That's not really an issue that we're going to cover in our guidance. We're not going to get too much into cooling towers there. But we're really talking about large building, premise plumbing. There are a number of them that put in disinfection systems in their buildings and making sure that they're operated properly. The VA hospital in Pittsburgh had a disinfection system in its building. And so I think the VA thought that they were protected because the system was there. And I think all of you know that it takes more than just having a system there to make sure the public's protected, right? It has to be properly operated and maintained. I think the last thing that I want to touch on here is just the work we're doing with small systems, with NRWA, with RCAP, with others. And for you all, it's primarily to say thank you again for all the efforts you've put forth across the entire country to help work with small systems. For those of you who operate small systems, to help your neighbors with challenges that they may encounter, and rolling up your sleeves and being willing to make sure that those communities that you serve are protected. I think NRWA has consistently done tremendous work in this area. We're very proud, as I told the board members this morning, very proud to have NRWA as a partner, proud to be able to support your work through our technical assistance grant, and very pleased to partner with USDA. Jackie's not here, is she? Jackie Ponte in the room? I don't think so. But certainly some of her folks, I had lunch with Jackie Ponte from USDA yesterday, and we're talking about how can we best partner with USDA to give you as much support as we can together to make sure that if you're applying for funds from USDA and EPA, that there's kind of a seamless intersection for you to do that, kind of lower the burden that you might have in trying to get through some of those issues. We developed a workshop in a box with USDA that some of you may have participated in, helping small systems with training, capacity development. Maria Lopez Carbo is here on my staff, who's running the branch that does a lot of the capacity development work, and it's so important to us, the work that NRWA helps us to do with small systems and the work that we do directly with small systems. And so I think I'm going to stop with that. I know I've been talking too long already, probably. I hope you're not bored to tears. But I'd be glad to take any questions that we can on this. And I did mention to the board, and I mentioned to Charles this morning, that if there are ways that we can partner more effectively with USDA, the Rural Utilities Service, to help you better, we want to know about what those things are. We would really like your input about what are the things where we can really make a bigger difference for you. So a big thanks to all of you. Greatly appreciate what you do every day. Very busy people with very important responsibilities. And it's great for me to be here with you. Thank you very much. So who's got a question for me?
I have one, sir, right here. Buddy Hayden from Mississippi. My question revolves around the triomethanes, haloacetic acids issue. We have 5 wells. Our major well is down. It's been down for the past year and a half. We have one well that pumps a lot of water, like 1,100 gallons a minute, but it has like 170 units of color in it. We mix that well with 3 other wells in the clear well, and we repump it. We have tried and been very unsuccessful putting a treatment process on what we call well number 4, which is a heavily colored water. The reverse osmosis treatment plant would take care of this. We are out of compliance right now as we speak with trimethanes and hallucinic acids. We have met with the EPA people in Jackson, and they tell us that the only way they would permit a reverse osmosis treatment plant would be if we could the discharge water that comes from that plant would be like 15 to 20% of the water that we pump. We would have to put that water into a creek or river that flows 50% more water year-round than we're going to put in it. Well, that's just about as impractical as me flying away from here, just waving my arms. It's not going to happen because we're too far away from a major river or stream. My point is, I know it's a problem, and y'all hand down these mandates for us to comply with, and then you make it so hard to comply with. And that's the real issue for us. And we've been out of compliance for the past year. We run a very good water system. We are solvent. But it's frustrating when we are trying to do our best out there. We could put in this reverse osmosis treatment plant, and what we wanted to do was put in a lagoon, let evaporation take place, and natural runoff. They won't permit that. So that's the real issue, and I'm sure we're not the only ones that has this issue, and it needs to be addressed. Thank you so much.
Yeah, thank you. If you can, before you give back the microphone, if you can just help me for 1 second. Is this primarily a federal EPA issue that you're struggling with, or a state issue?
Well, what we're dealing with is this. Everybody we talk to revolving with the EPA, they're scared to death to make a decision because they're scared that they get their heads chopped off in Washington, D.C. It's just that practical. All they will say is that we've got to place that discharge water into a river or stream that provides 50% more water than we're going to put in it. And we're too far away from the Mississippi. We're too far away from the Pearl River. I mean, that's not even practical to think about.
Right. So I appreciate the issue that you're raising. It's a pretty specific one that we might need to follow up on, and I'd be glad to, follow up with the region about this. I think part of what's going on is not only are you trying to implement, a rule under the Safe Drinking Water Act, it seems like there's some discharge permit issues that really get into a whole different part of the law, the Clean Water Act as well. But I would be glad to follow up and see what we can do to help you with that.
Well, I just have a problem understanding we can catch the raw water and drink it, and it's not a problem. Not a problem at all. But yet, when we filter it and have that brine water, it's just like it's poison. And I have a hard time relating to that. I really do. I just can't see why we could not put it in a lagoon and again let natural evaporation take place and natural runoff. Because we're in Mississippi, it's hot, it's humid. We have a lot of evaporation that takes place in our ponds and rivers. And would appreciate you, I'll be glad to see you and give you addresses and names after we meet.
I think that would be great.
Okay, thank you so much.
And I have Maria here in the second row can also connect with you to make sure that we get the information that we need, okay? And we'll be glad to follow up and see what we can do to help you. Before we go to the next, I just want the record to show that I have never cut anyone's head off. Just, some people may have felt like I did on occasion, but
Hi.
Next, yes.
Dr. Grevatt, thank you for being here. We really appreciate it. Pharmaceuticals, can you address what EPA is doing? Pharmaceuticals, we get a lot of questions from consumers.
So I wonder if you can help me with a slightly more specific question about pharmaceuticals so I can best answer you. Yeah, so I think this speaks to the issue that again, I mentioned that Billy raised with me yesterday is, as we have increasingly sensitive techniques, we can sample, we can see more stuff in the water. And the question is, so what does that mean for us? I think one of the, and it is, I think, fair to note that pharmaceuticals and personal care products are issues that people have been increasingly concerned about, right? So, for example, how much estrogen are we drinking every day? Or how much ibuprofen are our kids drinking every day? Probably very, very minute amounts, right? But perhaps measurable amounts. And I think that it does present a challenge for us, if nothing else, in terms of communicating safety for the public. One of the places where the questions about pharmaceuticals have been coming up maybe more frequently are around water reuse, and particularly direct potable reuse. And I'm, of course, going to have the opportunity to talk in another session shortly after this one on water reuse that Shelley Shard McClary has put together, and I'll probably talk about it a little bit there. But, our process, those steps that I mentioned of developing a contaminant candidate list, of doing this nationwide sampling, the unregulated contaminant monitoring rule, are really designed to see, is there something out there that we don't currently regulate that's presenting a hazard that we should? Okay, and so this reg determination, the preliminary one that went out for public comment, said strontium maybe is one that we have to think about regulating. There weren't any pharmaceuticals on that list. Okay, so I think we certainly have not gotten to the place where we're saying there's something out there that we have to go after, but we think it's important to understand as much as we can about what happens to be out there. And there are certainly people who, when they're done with their medicines, that, one of the worst things that can happen with a medicine is having it sit in the medicine cabinet, and maybe some kids get a hold of it accidentally or something, so some people will flush it down the toilet. Well, then there's something that's coming into the waste stream that you have, or into the source water you have to think about. So we're working these issues, but currently there isn't anything I would say that rises to the level in terms of pharmaceuticals, so we'd say, yeah, we need to regulate that. Other questions?
Yeah, are you able to address emerging issues on the wastewater side, and specifically also the status of the 2012 Clean Watershed Needs Survey?
I cannot give justice to those issues. We do have some folks from our Office of Wastewater Management here, and I'd be happy if you want to take your card and follow up with you about that. But since my colleague Andrew Sawyers is not here, who's the one I would turn to for that, I don't want to toss out an answer and have it be something that's inaccurate for you. So I would be very glad to follow up with you and let you know about that. Sorry, I can't help you with that one. Other questions?
Yeah, what if you could... Is this on?
Yes, sir.
Could you speak to source water protection in a number of ways? Around the country, different states have different requirements for things like spill reporting notification to the downstream water supplies. And various states also have their own position on whether intake locations are secret or it's public information. So I wonder if EPA can look at what the various states are doing and what's working and maybe what's not. What are good practices that maybe could be adopted nationally?
Yeah, that's a great question. I really appreciate that. So from the federal level, we are very actively working with states now and with local communities, with American Water Works Association and others on source water protection. In fact, I see Jim Taft who is the executive director of the Association of State Drinking Water Administrators on the left side of the room here, at least from where I stand on the left side. And Jim is one of the key players in a group we call the Source Water Collaborative that has over 20 membership organizations who are all rolling up their sleeves, getting together to say, what can we do on source water? There are a number of real challenges on source water protection. The first is that within the Safe Drinking Water Act, the states have already completed everything they have to do under the Safe Drinking Water Act on source water protection, which was essentially review source water issues, identify, develop a report. This is way back 2003. Most of the states completed this task of identifying where there might be concerns on source water protection that ought to be followed up on. So there are things that states or utilities have to do on source water protection. But if we look at the example of West Virginia American Water, all right, so that served Charleston, West Virginia, and if we look at the example of Toledo, they're really different issues. In January of 2014, when the Elk River spill occurred at Freedom Industries, I remember having conversations with Jim and others and speaking publicly and saying, the single biggest mistake I think we could make right now as the EPA is to conclude that the largest threat to every drinking water system in the country is a leaking tank at a coal washing facility, right? Every system has a different kind of a challenge they might have to look at in terms of source water protection. And certainly in Toledo, if you look at some of the land uses in the surrounding areas, you see lots of opportunities for introduction of fertilizer, both from POTWs releases, from suburban lawns, and from agricultural areas, all feeding into the Maumee River, coming right into that corner of Lake Erie where Toledo is located. So they are really in a kind of right in the middle of a bullseye for some challenges around algal blooms from nutrients, largely from nutrients. And so I think we need to work with systems, trying to find tools to help you to be able to, and with states, bring up the best examples of how folks have been able to get their arms around source water protection challenges. And some of these take a lot of time. If we think about the Salmon Falls project, which is in the Northeast United States, which is a great success in terms of source water protection, took a lot of time to get through that, working with lots of small individual, say, groups who might be concerned about even a little stretch of a river that's near their community or something. One of the tools that we've recently developed and was discussed yesterday, we're calling DW Maps. It's a GIS-based mapping tool that allows you to visually see potential sources of contamination around a fixed point that you might identify. Okay, so say you've got a well, or say you've got an intake on a surface water intake. You can identify that point in DW Maps. It can bring up all the POTW releases that might be up gradient. It will allow you to see those release points from POTWs, for example, that are within a defined travel time from your intake. You can click on those individual POTWs and find their compliance reports online from EPA's system. We have land cover data that will show agricultural land. We have data that draws on Superfund sites that will show where there might be a waste site of concern. So this is a tool that we want to, help people visually see, so is there something here that I ought to be looking at? Is there something I ought to try and do? But source water protection, it's tough business, but we know that this is the cheapest way, right, to keep contaminants out of drinking water supplies. It's the most effective way to do that. And one of the things we heard as we worked on sanotoxins, I know this issue may not have affected you all in this room, but one of the things that we heard from a number of some of the medium and larger water systems is, when you do a health advisory, EPA, when you identify a level that you say is safe or above this level might not be safe, and when you provide recommendations on treatment to a water system, you are taking this problem that's a regional problem, and you're saying you, drinking water system, is the point at which we have to solve this. And we think that's not sufficient. We can't stop there. Yes, we want to be clear on how to make sure we're removing dangerous contaminants from source waters. And thank goodness the folks in the Ohio River have worked so hard this summer to keep cyanotoxins out of their finished drinking water supplies. But at the same time, we want to get the cyanotoxins out of that source water in the first place. We don't want your jobs to be harder than they already are. And so trying to think about how we develop tools to help you with that is really an important part of our focus. So I appreciate you raising the question. And DW Maps is now available for public review, I think. I don't see my DW Maps people here in the front row. Have they already left, Maria? Downstairs talking about DW Maps. So anybody who's interested in that, we can make sure you have the information on it. We think it's a pretty exciting tool that might be helpful to you. Other? Oh, Maria's telling me it's time to get off the stage. She's so good. She's so good. Either that or she's saying, my watch is broken. Thank you very much.